Regenerative medicine is an innovative medical subspecialty that strives to treat or prevent injury and disease by naturally repairing, restoring, and regenerating damaged or diseased organs and tissues. This field has exploded in recent years to meet the needs of patients with both complex and common medical problems. Some regenerative medical therapies aim to slow or stop degenerative or pathophysiological processes that ultimately present themselves as symptomatic conditions. Other regenerative therapies activate the body's native repair system by influencing the behavior of somatic and progenitor cells to stop degenerating and start regenerating. Stem cell therapy is decades-old regenerative medical technology that has shown the ability to supercharge the body's ability to repair itself and to combat disease and injury. Recent scientific evidence indicates that the core mechanism of stem cell therapy, which has been very successful in the treatment of different medical conditions, lies in exosomes. Stem cell therapy most commonly employs the mesenchymal stem cell, a natural precursor cell involved in the development of connective tissues that has the capacity to transform into other cell types with more specific functions. Mesenchymal stem cells also have the ability to support normal growth, development, and tissue repair. For regenerative medicine applications, healthcare providers have used both young mesenchymal stem cells, which may originate from perinatal tissue, such as the umbilical cord, and adult mesenchymal stem cells, which may originate from bone marrow or fat. Originally, scientists and physicians believed that these stem cells exerted their effects by engrafting and differentiating into different cell types to replace diseased or damaged tissues. More recent evidence clearly demonstrates that these stem cells do not engraft, but work by a paracrine mechanism, meaning that they influence the behavior of other cells within the same tissue environment. In the case of allogenic cells, those harvested from another person, these cells survive less than 3 days after transplantation. In the case of autologous cells, those harvested from tissues in the same person, these cells survive for about 7 days. In either case, the function of these cells during that time is to produce and release exosomes. The nature of these exosomes depends on the parent cell type and the tissue environment, but these exosomes mediate the paracrine effect of the stem cells. So, what are exosomes? Exosomes are sophisticated, nanoscale biologic signals that are contained within extracellular vesicles. These membrane-enclosed capsules, ranging in size from about 20 to 200 nanometers, are filled with cellular signaling information. Virtually every type of cell produces exosomes as a means of intercellular communication, so exosomes are the essence of the message of the parent cell. That message may tell other cells to reduce inflammation, repair damaged tissues, or even reverse aging. Proteins constitute one part of the message of exosomes. The most familiar type of proteins contained within exosomes may be referred to as growth factors. These proteins trigger cellular signaling pathways that indicate specific behaviors in the target cells that internalize the exosomes. Some of the proteins contained within exosomes are growth factor receptors, which may cause growth factors to influence the behavior or the target cells in different ways than the growth factor would alone. Binding proteins also contained within exosomes may have a similar effect. Enzymes contained within exosomes may augment normal enzymatic pathways or restore lost or deficient enzymatic processes exogenously. Finally, immune modulators are signaling proteins that influence inflammation and the activity of the immune system. Messenger RNA comprises another important part of the message contained within exosomes. mRNA is the blueprint for protein production, and proteins govern the structure and function of cells. The mRNA contained within exosomes induces target cells to translate numerous copies of each of the proteins that correspond to each exosomal mRNA. In this way, exosomes can directly hijack the natural protein production machinery of the target cells. Each strand of mRNA remains viable for about 30 days, which may contribute in part to the sustained effect exosomes exert on target cells. The persistent effect of the exosomes on the signaling of the target cells. Cells may have capacity to selectively load exosomes with specific contents, and if the parent cell exosomes influence the loading of the target cell exosomes will perpetuate the message of the parent cells as they are internalized by secondary or tertiary target cells. These cascading effects may allow the original exosomes to cause lasting effects on cells and tissues that persist much longer than the original contents of the exosomes. MicroRNA represents another important part of the message of exosomes, which scientists have only very recently begun to understand. These short, non-coding strands of RNA bind to complementary strands of mRNA. When microRNA binds to mRNA, it has two effects. 1. MicroRNA obstructs the binding of ribosomes to mRNA, preventing the translation of specific mRNA. The other effect results from microRNA destabilizing the mRNA strands, causing them to degrade more quickly. The combined effects of microRNA on endogenous mRNA act as an off-switch for specific protein production, making microRNA just as important, if not more important, a signaling mediator as the proteins and mRNA contained within the exosomes. All of the contents of exosomes are contained within a lipid bilayer membrane, very similar to the parent cell membrane. The exosome membrane, while similar to the parent cell membrane, is not identical, as the membrane proteins and the phospholipid composition may vary. These variances may have some significance related to exosome homing or internalization. The primary function of the exosome membrane is to protect the contents of the exosome from degeneration by circulating proteases or RNases. The exosome membrane also serves to facilitate internalization of the exosomes into the target cells. Perinatal MSC exosomes contain the proteins mRNA and microRNA, packaged by mesenchymal stem cells, the youngest progenitor cells of the connective tissue lineage. These cells naturally support the development of connective tissues like skin, hair, bone, muscle, and cartilage. Mesenchymal stem cells also possess beneficial biologic properties that could have applications in regenerative medicine, and these biologic effects are mediated by the exosomes that the MSCs produce. The most important property of perinatal MSC exosomes is that they are produced by very young stem cells, less than a day old, that have the greatest regenerative potential. Numerous studies have demonstrated that perinatal MSC exosomes have multiple innate biologic properties that could have profound effects in regenerative medicine. These exosomes reduce inflammation, which is now understood to be a core mechanism of many diseases and traumatic processes. Excessive activity of immune cells also plays a role in many autoimmune and degenerative conditions, and perinatal MSC exosomes have demonstrated efficacy in modulating the activity of immune cells. These exosomes also promote the development of connective tissues and blood vessels. Perinatal MSC exosomes have also demonstrated efficacy in preserving the viability of damaged cells, which has the effect of preventing apoptosis and necrosis. In severely damaged tissues that do not survive, these exosomes reduce the extent of fibrosis and scarring in the healing tissues. Perinatal MSC exosomes have also shown suppression of tumour growth in preclinical models that have been studied. It is important to note that these biologic properties may be related to one or more of the proteins, as well as the microRNAs contained within these exosomes. One of the more important points to understand when considering the biologic properties of perinatal MSC exosomes is that their effects are not the result of any single protein, mRNA or microRNA, that is contained within the exosomes. Instead, the biologic properties of these exosomes result from the combined effects of hundreds of proteins, mRNAs and microRNAs, acting in concert on multiple signaling pathways and having direct effects within the target cell. The composite effect of these exosomal signaling factors sometimes causes predictable effects based on the exosome constituents. At other times, exosomes may exhibit paradoxical effects that cannot be easily explained by the well-understood biologic activity of their individual contents. In the case of perinatal MSC exosomes, they appear to have a positive net biologic effects across the models of injury and disease that have been studied in vitro and in vivo. One explanation for the beneficial biologic properties of perinatal MSC exosomes exert may be related to their role in nature. The natural function of perinatal MSC exosomes is to support the development of the fetus. A central function in this regard is to promote the rapid, controlled cell proliferation that underlies growth. These exosomes also play a role in suppressing inflammation in utero to allow the pregnancy to be carried to term, and modulating the maternal immune system to prevent rejection of the fetus. Supporting the development of connective tissues and their blood supply are also important roles of perinatal MSC exosomes. Finally, these exosomes participate in the suppression of oncogenesis by controlling the growth of the rapidly dividing cells. The biological properties of perinatal MSC exosomes differ from those of adult MSC exosomes. The closest analogue to mesenchymal stem cells in the adult are progenitor cells that may be harvested from bone marrow or fat. These adipose-derived or bone marrow-derived stromal cells behave differently and produce exosomes with different contents than perinatal MSCs because of the age-associated decline in the numbers and level of function of these senescent progenitor cells. For example, at birth, there are about 1 in 10,000 MSCs in bone marrow, while at age 20 there are about 1 in 100,000 MSCs in bone marrow. These senescent progenitor cells also express different proteins and miRNA than prenatal MSCs. One familiar example of this loss of protein expression may be illustrated by the reduction in lactose expression in adults, which results in lactose intolerance in many adults. Another clinically relevant example of the loss of protein expression in adult cells is the reduced expression of tumor suppressor proteins, which explains why many cancers are frequently diagnosed later in life. Finally, recent cataloguing of microRNA present in circulating microvessels indicates that the levels of specific microRNAs change with aging or in specific disease states. Tissue-derived exosomes also differ from isolated perinatal MSC exosomes for several reasons, one of which is that sampling tissues for exosomes yields a multitude of different exosomes produced by different cell types, which differ significantly in their contents and corresponding biologic properties. MSC exosomes constitute only a very small fraction of the population of exosomes and other biologic material in both adult and perinatal tissues. In order to concentrate MSC exosomes from composite perinatal tissue, different methods may be employed. One such method is sterile filtration, which can remove cells and other larger particulate material from the samples, but unfortunately leaves nanoparticulate debris with similar size and density to the exosomes along with the entire fraction of exosomes produced by different cell types. One example of particulate contamination that may persist after this type of filtration may be ABO blood type incompatibility antibodies, which could cause life-threatening complications if unknowingly administered along with exosomes. Another method for MSC exosome isolation is antibody-coated bead extraction, which uses antibodies that bind to MSC exosome membrane proteins to separate these exosomes from the other biologic material in tissues. Unfortunately, the antibody remains attached to the exosome after this separation, creating the potential to trigger an immune response. Compared with both of these methods, isolated MSC exosomes can be much more safely and effectively harvested from isolated MSC cultures, which virtually eliminates the potential for contamination with particulate biologic material and infectious agents. The results of nanotracking analysis demonstrate a clear difference between the exosomes harvested from isolated MSC cultures, illustrated above, and exosomes derived from processing tissue samples. Nanotracking analysis can determine the size and number of nanoparticles reflecting light in a sample. In the upper row, the size distribution shows a single peak indicating a consistent population of nanoparticles, as opposed to the multiple peaks in the lower row, which indicate significant particulate contamination. Also, the scatter plot in the upper right shows dense clustering of particles by size, indicating the consistency of the sample of isolated MSC exosomes. In the lower right, there is significant scattering of the results representing a very inconsistent sample consistent with particulate biologic contamination. Optimal methods for isolation of MSC exosomes begin with rigorous screening of tissue donors and subsequently the donated tissues that exceeds the standards required by the American Academy of Tissue Banks. After successfully screening the donors and tissues, isolated mesenchymal stem cells may be harvested and cultured on chemically defined synthetic growth media, which contains no animal or human products. Over a period of about 4 weeks, the cultured MSCs will produce significant numbers of exosomes and release them into the growth media. This conditioned media can be sterile filtered to remove the cells and any material that is not the same size and density as an exosome. Unlike processed composite tissue samples, conditioned media produced by isolated MSC cultures does not contain any biologic nanoparticulates that might contaminate the exosome's fraction after filtration process. Despite the intrinsic purity of exosomes isolated in this fashion, the product of filtration should still undergo sterility and endotoxin testing to confirm the absence of any infectious agents. Specialized protein and RNA sequencing identifies the specific contents of the exosome sample. Finally, STORM, super-resolution fluorescence microscopy, is able to confirm that these protein and RNA contents are contained within MSC exosomes. STORM, super-resolution fluorescence microscopy, is able to quantify single-molecule fluorescence and identify individual proteins on the surface of exosomes. CD9, 63, and 81 are membrane proteins that are characteristic of mesenchymal stem cells. Detection of these proteins by STORM microscopy in a configuration that resembles the size and three-dimensional structure of the exosomes as illustrated on the lower right allows direct visualization of the exosomes and confirms that these exosomes originated from mesenchymal stem cells. Unlike nano-tracking analysis, which can only detect size and number without identifying nanoparticles, STORM microscopy can also directly count the MSC exosomes in a sample and can visualize exosome movement and internalization into cells in real time. You may be wondering why any of this matters. Consider why the science and clinical potential of exosomes might matter to a cancer patient. If physicians could use advanced exosome characterization modalities to detect abnormal exosomes produced by cancer cells long before the cancer could be detected by physical exam or traditional diagnostic tests, treatment could begin sooner, with potentially better outcomes. Perhaps physicians could utilize the innate perinatal MSC exosome property of tumor suppression to slow or stop the growth of tumors, or prevent the development of cancer before it begins. The intrinsic biologic properties of perinatal MSC exosomes may also provide some benefit in the preservation of normal tissues, damaged by the chemotherapy or radiation commonly used in the treatment of cancer. Ultimately, targeted exosome-based therapies could be developed for destruction of specific cancer cells without the collateral damage to normal tissues. All of these exosome-based diagnostic and therapeutic modalities could eventually help to improve the survival of cancer patients. Consider the impact that therapeutic MSC exosomes could have on the life of a spinal cord injury patient. Currently, the only real tool in the armamentarium for an acute spinal cord injury patient is high-dose corticosteroids, and this is part of the initial treatment protocol for spinal cord injury in trauma centers. The objective of this type of treatment is to reduce the inflammation, which is what causes the swelling and ischemia that lead to neuronal cell death and motor and sensory deficits below the level of the direct mechanical injury. Well, what if physicians could use the innate anti-inflammatory properties of perinatal MSC exosomes, combined with their ability to promote cell survival? Perhaps the use of MSC exosomes in the acute setting might reduce the rates of motor and sensory deficits after spinal cord injury. Also consider the case of a chronic, stable spinal cord injury. If MSC exosomes could reduce the chronic inflammation contributing to dysfunction in the CNS or help to regenerate neural pathways, patients may be able to recover some motor or sensory function below the level of the injury and reduce the disability resulting from these devastating injuries. Consider how exosomes might help a burn victim. If MSC exosomes can accelerate the cellular mechanisms that accelerate wound healing, then perhaps physicians could shorten recovery times, ease the difficulty of burn treatments, and reduce the risk of systemic injury that results from having a large area of damaged skin. The apparent improvements in tissue remodeling with reduced scarring exhibited in preclinical models of wound healing might also help to reduce or prevent scarring as well as joint contractures, which cause significant limitations in mobility. The objective is to help burn patients heal more quickly without scarring. Think about the potential benefits of MSC exosomes for just an average person. If the innate biological properties of perinatal MSC exosomes could be used to disrupt the pathophysiological cellular and biochemical processes associated with aging and disease, then perhaps physicians could slow degenerative processes and arrest the development of disease, or even prevent the development of genetic or metabolic disease and suppress the development of cancer. Any of these benefits could potentially help to extend the healthy lifespan of people. With continued research and development, it is quite possible that MSC exosomes could someday play a central therapeutic role in the treatment of injury and disease, including autoimmune, inflammatory, degenerative, metabolic, and neoplastic disease. Cardiovascular disease is the leading cause of death worldwide. In vitro and in vivo studies of MSC exosomes have examined the role they may play in the treatment of myocardial infarction, cardiomyopathy, and the underlying vascular disease. Many medical conditions with distinct clinical presentations have at their core common mechanisms of disease. In the case of cardiovascular disease, some of these pathophysiological processes include inflammation, ischemia, infarction, fibrosis, and mitochondrial dysfunction. In preclinical models of cardiovascular disease, MSC exosomes have demonstrated the ability to reduce inflammation, reduce oxidative stress, increase angiogenesis, reduce apoptosis, reduce fibrotic remodeling of cardiac and vascular tissue, and preserve mitochondrial function. Consider how these biologic effects on the cardiovascular system might benefit patients with these conditions. In vivo preclinical studies have shown that perinatal MSC exosomes may reduce infarct size and fibrosis after myocardial infarction with an improvement in contractility of the cardiac muscle, and that MSC exosomes could be used to reduce the chronic inflammation associated with dilated cardiomyopathy. Vascular disease, which is the underlying cause of many cardiovascular conditions, might also benefit from treatment with MSC exosomes by reducing endothelial damage and vascular remodeling. If physicians could reduce the consequences of these cardiovascular conditions, then perhaps the mortality rate of cardiovascular disease might improve. Dermatologic conditions may also benefit from the use of MSC exosomes. In vitro and in vivo studies of MSC exosomes have examined the role they may play in the treatment of various types of dermatitis, UV damage, wound healing, burns, hair loss, and scarring. These dermatologic conditions have some similar mechanisms of disease, which include inflammation, oxidative stress, apoptosis, tissue damage, scarring, and hair follicle degeneration. In preclinical models of dermatologic disease, MSC exosomes have demonstrated the ability to reduce inflammation, reduce oxidative stress, reduce apoptosis, stimulate proliferation of cells that heal damaged skin, increase angiogenesis, and enhance tissue remodeling with improved type 1 to type 3 collagen ratios and normal organization of collagen fibers. In the specific case of preclinical models of hair loss, MSC exosomes have demonstrated anagen phase recruitment, as well as regeneration of dermal papilla cells, which are the progenitor cells that make hair matrix cells. These biologic effects on skin could form the basis of future treatment for these and other dermatologic conditions. In vivo preclinical models of wound healing have demonstrated the ability of MSC exosomes to enhance cellular processes, including fibroblast and endothelial cell proliferation and migration, increased collagenesis, reduced inflammation, and accelerated healing. In these models, MSC exosomes also appear to optimize tissue remodeling with increased type 1 to type 3 collagen ratios and a normal lattice organization of collagen fibers. These biologic properties of MSC exosomes may help to accelerate wound healing and minimize scarring. Many aesthetic skin regeneration procedures work via the principle of collagen induction therapy, where a controlled injury to the skin stimulates a healing response that regenerates the skin for a more youthful appearance. Understanding the biologic effects of MSC exosomes on wound healing and scarring demonstrated in preclinical models, consider the potential benefits of MSC exosomes for the enhancement of this type of wound healing to accelerate recovery and increase collagenesis after common aesthetic procedures, such as microneedling, chemical peel, hydrodermabrasion, and fractional or full-field laser resurfacing. Scar reduction therapy might also benefit from the use of MSC exosomes as an adjunct to ablative fractional laser, microneedling, or subcision to improve the recovery and enhance the results of each treatment in the series of scar revision treatments. It might even be possible to prevent scars from ever developing by using MSC exosomes prior to planned surgical incisions or with early application of MSC exosomes after traumatic wounds or burns. MSC exosomes might also provide some benefits for both surgical and non-surgical hair restoration by stimulating growth factor induction, anagen phase recruitment, and dermal papilla cell proliferation. If MSC exosomes could help to regenerate dermal papilla cells, which are the source of hair matrix cells, then perhaps these exosomes could reactivate degenerative hair follicles. These and other biologic properties of MSC exosomes could potentially be used to enhance non-surgical hair restoration procedures or improve the survival of follicular grafts after hair transplantation. Musculoskeletal conditions may also benefit from the use of MSC exosomes. In vitro and in vivo studies of MSC exosomes have examined the role they may play in the treatment of osteoarthritis, osteoporosis, osteonecrosis, and fractures. The pathophysiological processes involved in these diseases include inflammation, cartilage matrix degradation, chondrocyte degeneration, cartilage wear, bone matrix resorption, and ischemia. In preclinical models of musculoskeletal disease, MSC exosomes have demonstrated the ability to reduce inflammation, induce more regulatory M2 macrophage polarization, improve chondrocyte function, induce chondrocyte progenitor cell proliferation and cartilage synthesis, improved the balance of osteoblast and osteoclast activity, and increase angiogenesis. All of these biologic effects on the musculoskeletal system might benefit patients with these conditions, which can be very difficult to treat. The primary objective of joint therapy is to reduce pain and inflammation. There are many types of treatment that may achieve this goal. However, the real objective is to slow or stop the degeneration of articular or joint cartilage. In preclinical models, MSC exosomes have demonstrated the ability to prevent proteoglycan degradation and sustain chondrocyte viability to preserve the cartilage matrix. Ultimately, the goal of joint therapy is to regenerate articular cartilage, and in these studies, MSC exosomes stimulate chondrocyte progenitor cell proliferation, induce synthesis of new cartilage, and rebuild subchondral bone. Future cartilage regeneration therapy using MSC exosomes may employ synergistic orthobiologic modalities. Since exosomes are extremely small particles and have no difficulty passing through vascular walls, including the blood-brain barrier, it is likely that MSC exosomes placed in an inflamed joint with its hypertrophic and hypervascular synovium may simply